Ladies and gentlemen, you're about to experience the Gut Check Project, talking science, health, and innovation that you can actually use. But this isn't just another health show. We're here to have fun and make your time enjoyable. Well, while you are enjoying yourself, know that even though the GCP covers some health topics with healthcare pros, we are not your doctors. So use our show to entertain your mind and not for medical advice. And now, here are your hosts of the Gut Check Project, Dr. Ken Brown and Eric Rieger.
Hello, Gut Check Project fans and KBMD Health family. I'm Eric Rieger, host of the Gut Check Project, joined by this awesome guy, Dr. Kenneth Brown. What's up, Ken?
What's up, everybody? Today is episode 92.
It is.
We're calling this one the Great Unboxing Episode because we have something really exciting to talk about today.
We do. We do have something exciting to talk about. In fact, I believe it's so new I don't want to screw up the name. I believe it is the KBMD Health SIBO Solution Box.
Correct. So we have been working for quite a while now to be able to come up with something that I have seen with my patients. If you have SIBO, definitely listen to this particular podcast. If you know anybody that has it, make sure you share it with them, because what we're trying to offer here is something that I've seen in my practice, a combination of different products working together to ultimately help all those people with SIBO issues. And that's what this is. We're going to do an unboxing of the KBMD Health SIBO Solution Box that will be delivered to your home, and we'll get way into it and look at every one of these products and why it's going to be convenient to take, how it's going to be both cost effective and effective for people that suffer from that.
So some people may be watching this for the first time and not really know about Gut Check Project, but even more importantly, wondering what in the heck is SIBO. So that's an acronym, SIBO, Small Intestinal Bacterial Overgrowth, correct?
Correct.
So how would
SIBO.
someone know if they even have this problem?
Before we get into that, I want to do one thing really quick.
Uh-oh.
I had a fantastic conversation with a fan today.
That sounds like it's worth stopping down.
It was definitely worth stopping, yeah. So this is a shout out to Carol Brantley, who's an avid watcher of the show. It is her birthday today. And she wanted to let me know how much she enjoys the show, how she watches everyone, and especially the last episode about you taking on the Pocky Challenge.
Yeah.
She thought was really funny, and she related to the fact when I started talking about trying to put in your contacts, she actually has done that, where she was cooking with peppers and did that. So shout out to her. She sent me a picture of her little fur baby, Trixie. And thank you so much for watching the show, Carol.
Happy birthday, Carol. That's awesome. If it means anything, I think we talked about that on my birthday last week. So
Yeah. Oh, that's right. It was your birthday last week. Yeah.
So
That's right.
There we go. Thank you very much, Carol, for getting in touch with Ken. That's awesome. And of course, anybody can go to kbmdhealth.com or gutcheckproject.com, connect with us. And then this guy, if he's really motivated, is going to give you a nice shout out. That doesn't happen all the time.
So before we jump into the science, what's going on with Eric personally?
Wow. So this last weekend, Gage had his baby shower at close to our house. We'd already done one out with Laney's family. It was
Nice.
tons of fun. While we're giving shout outs, I want to definitely recognize my sister-in-law, Jenny, and Stacy, who is one of Gage's best friend's moms. They were the two that hosted everything. It's a good thing I didn't do it, because it would have been a mess. But they did a great job getting everyone in. Everybody had a great time. More importantly, Gage and Laney felt love for them, and as well as the kiddo. And I could even say Mac, being Gage's brother, was there to take in a lot of the emotion around it. So it was actually it was great. It was
Awesome.
nice.
Yeah, those pictures were great. That is fantastic. So happy for you.
Thank you. What about you?
Not a whole lot going on. Carla had a great tournament. I took her to Austin last weekend, and she had a great tournament, and we just did the whole thing. Lucas and Loida were in Florida for another tournament at the Orange Bowl, a big tennis tournament, clay court. So we're just sort of winding up to the point where Lucas goes to college in January, and seeing how the house will have a partial empty nest syndrome, and we'll see how it works out.
And it comes quick. But
Yeah.
I know that y'all been working at it for a long time. So
Well, so there we are, the shout out and the personal stuff. Now let's just dive right into what we're talking about here. What was your question?
yeah, back to the question at hand, which was, what exactly is SIBO, if someone were to wonder if they have it?
So by definition, SIBO is when bacteria starts to grow where it shouldn't be, specifically in the small bowel, hence the name small intestinal bacterial overgrowth. So when bacteria grows there, if you eat food, then the bacteria starts to break it down before you can, and then that results in all different kinds of things like bloating, abdominal pain, diarrhea, or constipation. And we now can do breath tests on that to see if they've got positive breath tests that can show hydrogen sulfide, hydrogen, or methane. The funny part is that SIBO is a relatively new diagnosis compared to other things, and it used to be that people were just called irritable bowel, or they just had a functional bowel disorder. But now we know that a lot of these people, if you suffer from bloating or diarrhea or constipation or abdominal pain, really common things, then there is a chance that you have SIBO. Even if you haven't been diagnosed with SIBO, we made this box for people to at least try it because we're using all natural, highly vetted, third-party tested ingredients. So we know that it's really actually pretty good for you, all the ingredients, and there's a chance that it will significantly help you, and we'll get into all that. But that's what SIBO is.
Without question, it helps answer, I guess, the idea if someone's suffering and they don't quite know what kind of symptoms to look for. You mentioned that there is breath testing. Would you say that someone specifically needs to have a breath test to determine that they are having the symptoms of SIBO that match up otherwise, to think that maybe they should try something?
Yeah, so this is kind of a debated question. So in my practice, I have seen breath tests all over the map, and when I treat people, they get better. That's all I care about. You come in with symptoms, I'm not treating your breath test, I'm treating your symptoms. And I do know that there are other doctors out there, SIBO experts, who feel very strongly about the breath test, and that's okay. But in my practice, I can't have people keep coming back and saying, well, your breath test is still negative, but your symptoms are there. And then I will have a lot of people that'll do breath tests and the symptoms don't correlate with the breath test.
Yeah.
It's like, look, you're positive and you've got hydrogen sulfide. You have lots of diarrhea, right? They're like, no, I'm constipated.
We've even had patients come through the clinic whenever we've examined them, and their breath test has more or less kind of stayed the same. However, their symptoms have gotten better or improved, and otherwise, other than that breath test, they actually are enjoying a better quality of life. So we've experienced that quite a bit too.
Yeah, so I fall under the dictum of treat the patient, not the test.
Yeah, 100%. Leading to a box. Usually if there is a reason for someone to make a package, it's because, and I'm just going to throw some things out there that you and I have observed, but it's hard to put together things that work well with each other. It's hard to put things together that you know that each one of them is performing a specific task. It's hard to put things together that fit both of those categories and still remains affordable. Is this something that you feel comfortable with that we could address?
100%. It fills all those categories and one more. It improves compliance.
Nice.
Because we know that if you take the product for the way it's supposed to be taken twice a day, the way that we're doing it in the box here, for at least a month, which is what the box is for, then we know that you're going to get the best response from all of this. And that's what this health box is, delivered to your home. So the KBMD SIBO Solution Box. So,
you know, a wild thing about compliance, even back when I was with the pharmaceutical companies, 2 decades ago, compliance was always the biggest hurdle whenever you were trying to prove that something could or couldn't work for a particular patient population. And it just came down to just something's being prescribed and you're trying to help or at least see if you can make a difference with someone. But later when they admit that, I missed these doses or I had this issue and I didn't do it, well, it's not that necessarily the drug did or didn't work. You don't know because it wasn't taken. And so I like the fact that you're highlighting that compliance becomes less of an issue with this. And I'm kind of looking forward to showing exactly how that works.
Yeah, exactly. In fact, let's start out by showing it and then get into the science of the box.
Okay.
So basically, the KBMD Health SIBO Solution Box will be a box like this. It's small. It's convenient. On the back, we've got some messaging for you about our sort of why and what we're doing this for. And, of course, we have the little Gut Check Project logo here with a QR code so that you can follow that. But the really cool thing is we set this up so that the box will be pre-packed AM and PM packs. So if you're just listening to this, what I've done is I've moved the sleeve a little bit and I've pulled out a roll that goes AM, PM. So all you do is just get your pack, rip it off, throw it in your purse, put it in your pocket, and just move on.
Nice.
And so that's where you can go. And in this pack, The first empty one describes the ingredients, and the ingredients are atrantil, which we know has helped with SIBO, and then a histamine support product called diamine oxidase, followed by an immunoglobulin called IgY, and ultimately something to help it in the evening called ashwagandha. And we'll get into the reason why these are so great that actually work together for SIBO support. So as you see this, you can see that you'll pull out your AM pack, tear it off, throw it in your purse or pocket, and be on your way. And then there's a PM pack that you'll do in the evening. And it's just that easy. So when the pack is done, you've taken everything, you know how many doses you've missed. And in the pack itself are the individual capsules. This is what's so cool. You don't have to go to your bottles and open it up. And so this is for compliance. This is for cost effectiveness, because we've been able to do this at a huge cost savings. If you try to do this on your own, it would be extremely unaffordable. And we really hope that everybody's going to get the benefit from this. And we'll talk about the science of all that, of the ingredients. But that's the sciencey part. But the really cool part is, here we are. This is the box. Your health has arrived. And this is the SIBO solution box.
It's a really cool setup, honestly. The company, the packaging company that we use to make this happen, they have this really, really large, very sophisticated extemporaneous dosing machine that puts all of these things together. So just like if you were, unfortunate, had to have a quick stay in a hospital, but they wanted to make certain that you got the right doses throughout the day, they make these little things just like this so that patients are more compliant in the distribution of those, or the administration of those medications is more compliant. Basically, they're just taking that same tested regimen and putting it in your home. And what is cool is, let's just say that you want to travel you're going on a 3-day weekend. Just simply tear out 3 days worth of stuff, throw it into your bag or your purse, whatever it happens to be. You don't have to take any bottles. There's no clanking around. You don't even have to separate anything. It's ready to go.
I think that's so awesome. I would almost want to take all my supplements to that same manufacturing place and be like, this is my AM pack, this is my PM. Why don't you guys put that together for me so that I don't have to keep doing that. And my wife sees all the bottles that I pack when we go on vacation. So.
Ken has a bottle bag, in case y'all didn't know.
It's that famous thing Huberman said, which supplements are you on? All of them. All of them. All right, let's get into the ingredients. So if you have SIBO and you're wondering now why and what else is in here, and I don't really remember anybody telling me to take those particular products, that's probably true, because most of my patients that come in that they have either seen allopathic or functional medicine, they come in and a lot of them are not on this. And once I explain the science behind it, you're going to go, why have I not done this already? And that's kind of how I've been, where I'm like, wow, this is working. Then let's add this. This is working even better. And to be able to put it in a convenient delivered to your house box with these packets, this is a win-win-win for everybody.
Sure. Well, it is a unique combination. And the fact is that SIBO's been a moving target for a long, long, long time. If it had been already solved, then we wouldn't have a need for a box. And a lot of research has gone into this, not only from your clinic and your patients and the feedback that you've gotten from that. There's lots of collaboration between Ken, several other GIs, functional med docs, naturopaths, nutritionists. None of this stuff is guesswork. A lot of this stuff has been proven out through how well it's worked through people.
Absolutely. And so one of the things that I love to do is I love to talk to science. If the science makes sense, then it's certainly worth a try. So let's jump right in.
Let's do it.
We'll pull up the old AM pack here, and there's going to be 3 different ingredients in the AM pack. Rip this off. The very first ingredient is atrantil, our baby. Atrantil is the world's only patented polyphenol blend that has been shown in clinical trials to help 4 out of 5 people address their symptoms of bloating, abdominal pain, and change in bowel habits. So if you suffer from digestive issues, and certainly if you have SIBO or even a positive breath test, then there's a very high likelihood that atrantil can help those symptoms. Just recently, Northwestern University published a study where they looked at people with methane-predominant constipation, and they showed a significant clinical improvement in the majority of the people. And what's really cool is atrantil is composed of 3 complex natural polyphenols that help get rid of the gas and the problematic bacteria in the small intestine. What's so exciting is that we now know that these same polyphenols help improve your microbiome, which we Look at the episode where it says, what would your microbiome say? They help improve your microbiome. And when your microbiome is healthy, it will use the atrantil as fuel, and it produces beneficial molecules that we call metabolites that actually have potent anti-cancer, anti-aging, and anti-inflammatory benefits. And these go throughout your entire body, not just in your gut. This means that even if you don't suffer from significant digestive issues, these complex polyphenols are actually very good for you because they're the same molecules that make the Mediterranean diet good for you. Everybody says eat the Mediterranean diet, but nobody says, why is that diet good for you? Yeah. As it turns out, because it has pretty high protein and pretty high polyphenols. That's what makes the Mediterranean diet so healthy.
Yep, 100%. And just back to that Northwestern study that you referenced, everyone at Atrantil is very excited about the potential of what it's going to do. Not just because it's successful for Atrantil, but more importantly, I think it's going to help us reach people that have been searching for a solution. And the most ubiquitous complaint for people who suffer from, as you referenced, IBS, SIBO, anything like that, they all have one thing in common. It's bloating. And Atrantil in that particular study at Northwestern scored well in improvement in several categories, but bloating, honestly, Atrantil blew it out of the water.
Bloating and abdominal pain.
Yeah, abdominal pain, correct.
And as when we were talking to the principal investigator, Darren Brenner, he said, oh my gosh, that is the biggest headache for gastroenterologists. Yeah. And now you've got a natural treatment which helps them with essentially no side effects. Yeah, let's at least try it. And that's kind of what we should be talking to my colleagues about. You might as well try it. Now Northwestern just published some data to show that it is beneficial in the majority of people that take it.
And Northwestern did that study on their own without any endorsement from us, any support, sponsorship. In fact, they even purchased the product from us. And that's how we even knew they were doing it. They placed an order and said, we're going to study this. Leave us alone.
Yeah, that's exactly it. Yeah.
That's how it went.
So if you just take the Atrantil alone, there is a high likelihood that you're already going to start seeing improvement. But this is where the science kicks it up a notch.
All right.
So the second ingredient in the AM pack is diamine oxidase, DAO. Now, we did do a podcast with Joanne Kennedy, where she's an expert in histamine intolerance, and she discussed DAO. And I learned a lot from her, but diamine oxidase is an enzyme. It's produced by the lining of your digestive tract to help control the amount of histamine that gets absorbed in your body. Diamine oxidase, as I mentioned, is called DAO, so I'm going to start referring to it as DAO. Now, to understand why this matters, you have to know what histamine is doing. Now, histamine is a compound that's actually involved in digestion. It's involved closely with the nervous system, and it's involved in the immune system. So it's very, very important. And when it's in homeostasis or when it's at normal levels, everything's running fine. But when histamine levels get too high, it can actually disrupt all three of those systems. And that's why when people have gut issues, they may have other things going on.
Yep.
It could all be related to the lack of this enzyme breaking down the histamine. All right, so the DAO produced in your small intestine is there to neutralize the histamine that is both in foods and histamine produced by SIBO bacteria. Many people don't know this, but the bacteria themselves can actually synthesize and produce histamine also. So if you have intestinal inflammation, gut inflammation, and it could be from anything from celiac disease to an infection to Crohn's disease and, of course, SIBO, then that inflammation decreases the amount of DAO that your body is producing. Then whenever you eat any foods that have histamine, the DAO is not there to neutralize it and it gets absorbed. But if you have SIBO, it's the double whammy. The bacteria themselves can use the food to produce histamine, which is why I think so many SIBO people feel like there's just so much more going on than just in their gut.
Without question. Histamine is often related to any type of inflammation, regardless of where it's occurring. You have a bee sting. Essentially, it's a histamine reaction, right? I mean, it's in part how your body allows blood flow to be increased in the area of infection or assault or something else like that. But if it's happening systemically and it's happening all of the time, you're basically walking around as an inflamed individual, and you can't heal. And we'll get to it in a moment, but you can't sleep. And there's a lot of different things that occur whenever there happens to be high histamine production. So if you happen to be short and the enzyme is supposed to strike your balance, it should make sense that if by restoring it, that you could allow your body to return.
Yeah, totally. And so what happens is, so if you have SIBO and you do not have DAO to break down the histamine, then this histamine gets absorbed. And when this happens, it can cause all kinds of issues. At the very least, it can cause abdominal pain. It can cause cramps, diarrhea, and constipation. But it can also cause brain fog, fatigue, anxiety, and even migraines. And many of my patients that come in and they have SIBO, they come in very restricted diets, and they keep telling me that they have all these food intolerances, and they keep avoiding more and more foods. Now, I have seen that very often it's not that they have a food intolerance, they're developing intolerances. It's that they actually have a low DAO level, and that intolerance that they're referencing is actually caused by the histamine.
Yeah, they're attributing it to the wrong source. They simply just don't have the right balance. And the only thing left off that list, again, technically kind of insomnia. And if you really want to test it, look at like
Yes.
a little kiddo. Sometimes I've just heard of parents who may want a kiddo to take a nap and they give them Benadryl. What is Benadryl? It's an antihistamine. And suddenly a kiddo gets sleepy and tired and goes to sleep, albeit not in the same mechanism per se as DAO, but it is not, it's basically decreasing the amount of histamine that's able to stimulate this young kiddo to stay awake. Well, applying that same knowledge that would work, you just simply want a natural balance between your DAO and your histamine levels.
Yeah, for sure. And even Joanne Kennedy referenced that when she gives her patients DAO, they sleep better.
Yep.
Because of that exact same reason that you're talking about. What people don't realize is how many foods actually have a high level of histamine in them. I mean, some of the more common foods that have high histamine are like avocados, eggplant, spinach, all fermented foods, anything fermented, sauerkraut, kimchi, pickles, whatever. Cheese, alcohol, smoked meats are just a few. Those are just some of the foods that have it, but there's so many more that are out there. And the other thing people don't realize is many medications that we take actually decrease the DAO enzyme.
Yeah.
Medications like aspirin and ibuprofen that people take all the time, that lowers your DAO. And in addition, high blood pressure medicine, which so many people are on, and even antidepressants, all these things lower this enzyme.
Yeah.
And it's something that nobody's really talking about.
You know, back to the food that you listed, it's not that any one of those foods necessarily is a bad food either. You should be healthy enough in balance that those foods, for the most part, shouldn't really throw you out that you can't tolerate them. It's probably more indicative of a lack of a good balance of DAO versus a sudden sensitivity to these foods.
Exactly. And so when you stop and think about it, when you combine atrantil with a high quality DAO enzyme like the one that we're using that has been third party tested, it makes a huge difference in what you can eat and also your symptoms and ultimately the systemic effects of the histamine.
Totally agree.
So just those two things alone, that's pretty badass.
Yeah, very badass.
And after meeting with different researchers and talking to a lot of different people, came up with this third ingredient in the AM pack. Now, the same ingredients are both in the AM and the PM. The PM just has one more ingredient that we will get to. But the third ingredient here is something that's called IgY, or immunoglobulin Y. So IgY immunoglobulin, all immunoglobulins are known as antibodies. Mm-hmm. And these are molecules that are produced by the immune system to specifically bind and attack invaders like bacteria, viruses, and allergens.
Yep.
So if you have SIBO, SIBO can actually lead to something called leaky gut. And if you're unfamiliar with SIBO and leaky gut, those that have SIBO understand leaky gut. Basically, the inflammation creates this situation where you have what are called tight junctions and they open a little bit, and then SIBO creates leaky gut, which then allows these different pathogens to more easily get through and get exposed into the blood. Mm-hmm. So these, think of it like small bacterial particles can leak through, and allergens can actually leak through these tight junctions. And by doing that, it turns on the immune system.
Sometimes it doesn't even have to go all the way through. Just a small breach can allow the little bitty nerve fibers, the little dendrites, to come in contact with another allergen. And what does it do? It stimulates another histamine release on the other side of the gut barrier.
That's exactly right. So what Eric's describing is the immune system gets turned on, and one of the responses when the immune system starts sounding the alarm is to release histamine, because like he had mentioned earlier, one of the things it does is it recruits more cells. In other words, it creates chronic inflammation.
Yeah, definitely.
And we're back to that histamine thing one more time. So these small bacterial particles are actually called lipopolysaccharides, LPS. The reason why I want to really hone in on this is because all this new research is coming out. LPS is let's just call it the shell of the bacteria. Okay. So even if the bacteria dies, its shell, its casing, let's call it, the casing is there. That's called LPS. And it is now believed that LPS may be one of the major causes of dementia.
Oh, it's terrible.
You know how we always talk about how all health begins and ends in the gut? And we talk about how inflammation is inflammaging? Well, now there's data showing that it could be that these LPS particles are the things that you just described, which turn on the immune system, which then lead to neuroinflammation. It's these LPS particles which keep triggering the body. The body wants to get rid of it so bad that it just keeps creating this inflammatory response. In fact, one of the first places that I heard about it was when we had Kieran Christian on the podcast. And I was a little bit behind where I was like, LPS? And he said, yeah, it's one of the causes of dementia now. We know that. We have to get rid of that. So knowing that, and knowing that even if you've got the atrantil in there and it soaks up the gas and it is getting rid of the bacteria, it's killing some of the bacteria, and you've got the DAO, which is there making sure that the histamine's handled, you still may have debris in the small bowel. So this is where this comes in. The IgY actually comes in, and it is known to tightly bind to LPS.
Nice.
It's a magnet to LPS, and it grabs it, and it removes it from the small bowel so that it can't leak through those tight junctions. One of the things that people have heard of, whenever I start talking about this with patients, they say, well, this sounds like colostrum. Oh. And I've heard of bovine IgG. Yes, very similar. Colostrum is the milk that's first produced by a cow, and it's rich in nutrients, but colostrum is primarily used because it's rich in IgG, or immunoglobulins. So then researchers figured out that we don't have to just use colostrum. Let's use the part that's most beneficial, IgG. And there's several companies out there producing IgG that do this. And so the data is there. The reason why I chose IgY is because when you look, IgG actually can be digested as it goes through the gastrointestinal tract. IgY, so IgG is traditionally from cows. IgY is from a chicken egg. So if you have an egg allergy, that's the only contraindication, not an egg sensitivity, a true allergy. Very, very, very few people actually have that. But the IgY is structured differently, and it's more stable.
Yeah.
And it actually stays intact through the gastrointestinal tract, through the stomach acid. And when it makes it to the small bowel, then that's when it binds the LPS and stuff. That's when it binds the bacteria. That's when it neutralizes viruses and gets rid of the allergens. The way that I think of it, if you think of IgY like a bulldozer, so atrantil goes through, it sets the stage, DAO makes sure there's enough enzyme there to get rid of the histamine, and now we need a cleanup crew, and that cleanup crew is IgY, and it comes through the small bowel, and it grabs all that LPS that could otherwise fall through the cracks and be one of the causes of dementia, one of the causes of autoimmune disease. That's the other thing. It grabs it and it removes it from the small bowel and takes it to the colon where it's completely neutralized there. And then you just expel it. And so that's why that particular combination of having that bulldozer-like IgY come in to play cleanup, I think is really, really, really cool.
Well, the stability between it and IgG is somewhat of a great comparison. If I remember correctly, I don't have it in front of me, but I think that IgG, although great, just like you said, it can become digested, and it just simply has I think it's 2 subunits, where IGY actually has 4 or something like that.
Yeah.
And so it delivers itself in a more stable form, much like Cabracho and Atrantil. There are many, many great polyphenols, but a large polyphenol assembled as a tannin can survive the transit and still do the work throughout without having to be degraded.
That is a great analogy, which is probably why subconsciously it made so much sense to me. But that's the first time that I've compared the two. Yeah.
I've got all kinds of nuggets, Ken.
Yeah. And there's a little more science as to why. One of them involves something called the FC portion of the immunoglobulin. So for immunologists, in theory, IgG can bind to the FC portion, which has been implicated in turning on certain autoimmune diseases. IgY doesn't, so it's a safer way to do it also.
Nice.
But that gets a little too sciencey, in my opinion, for a show like this. So, but it's just another layer of safety. Okay, so now that's the AM pack. So you've taken your AM pack, you've got the Atrantil, you've got the diamine oxide, and you've got the IGY. You've taken that. Then for your PM pack, you have the exact same 3 ingredients, and we've added a 4th. And this final ingredient in the PM packet, it's called ashwagandha. The PM packet still has all the other supplements, plus we've added ashwagandha. Now, I put ashwagandha in the SIBO Support Box because we know that there is a significant brain-gut connection.
Definitely.
And ashwagandha has been shown to help improve this connection. And it does that through a couple different mechanisms. It has been shown in clinical studies to actually improve anxiety, decrease cortisol, and help improve the quality of sleep in those with and without insomnia. So this is extremely important because so many of my patients that have gut issues have anxiety also.
Yeah.
And it ends up becoming something that feeds on itself. Because if you have anxiety, that is that brain-gut connection. It can actually change the motility of the intestines, which then leads to more SIBO. Then more SIBO leads to more inflammation, which leads to more anxiety. And that's one of the reasons why so many of my patients come in and they're just like, I don't know what's going on. I don't know if it's my gut causing it or my brain's causing it. But we know that anxiety plays a role in this, and we have to start stopping that. Now, after the anxiety, when you start having this more inflammation, if you have increased cortisol levels, cortisol is the fight or flight. It's one of the fight or flight, I don't want to call it hormone proteins. So cortisol, is cortisol a hormone?
That's a steroid, so I mean, I guess it's technically a hormone.
I guess technically because it goes around the body and does stuff. I always think of the hormones as, the sex hormones and stuff. Regardless, cortisol. Why don't you want cortisol going up all the time? It's a great fight or flight situation, but when it's up all the time, it leads to more inflammation. It's implicated in obesity, metabolic syndrome, and the same thing over and over, inflammation.
And not only that, also an increase in LDL cholesterol. If you have high cortisol levels, which happens when people, for instance, when Ken's talking about fight or flight, let's just take something else. A lot of people that we have come through the clinic have issues with sleep apnea, and they end up, unfortunately, long-term sleep apnea sufferers oftentimes end up with some type of coronary vessel disease or blockage of their coronary vessels in their heart. And that usually is because while they're gasping for air in their sleep, their body is feeling like it's drowning and not getting enough oxygen. So it's always keeping them somewhat elevated. So they don't ever really get good sleep because of cortisol. And because of that constant fight or flight, now your body is trying to prepare for fighting or fleeing. And you've got little bitty LDL cholesterols that could be used for energy, but they're not. And they begin to collect, and then they get blockages of vessels. And you don't want constant levels of cortisol. Cortisol should be high in the morning and then drift down throughout the rest of the day.
Exactly. And you touched on the sleep aspect here. So why is sleep so important other than what he was just talking about? Sleep's super important for a SIBO person because what you need is when you go to sleep, a normal person, as you sleep, there's something called the migrating motor complex, the MMC. The MMC turns on, and what it does is it sends a wave through your stomach and small bowel about every 90 to 120 minutes, and that cleans out the small bowel, so it pushes it all into the colon. That's called the housekeeper phenomenon. As it turns out, people with SIBO don't have that. And so that housekeeper phenomenon is gone. So when you go to bed, if you're not getting into deep sleep, into those different stages to allow that to happen, that doesn't take place, and you don't ever clear out your small intestine. So by getting into a deep sleep as we're clearing out the intestines and ultimately decreasing the anxiety and the cortisol, then we can start waking that migrating motor complex back up so that that can clear out while you're getting a good night's rest.
It's critically important also because small intestinal bacterial overgrowth, I mean, really the fact that we even call it overgrowth is kind of a misnomer. Bacteria in the small bowel should really always be in transit and should never be reproducing in the small bowel. You kind of want your small bowel to be maintained as close to sterile as possible with everything just going through. It's really there just to absorb fats and a few other small details, but everything else is to go through.
Yeah, absolutely. So in summary, so to summarize the KBMD Health SIBO Support Box, let's recheck how everything works. So in the AM pack, the Atrantil comes in with its stable polyphenols, and it begins to soak up all the gas and get rid of the bacteria that is growing in your small bowel, known as SIBO. Now, SIBO causes your DAO enzyme to be decreased, which then results in too much histamine being absorbed. The DAO supplement then neutralizes this excess histamine and prevents it from being absorbed. Finally, the IGY immunoglobulin supplement works like that bulldozer that we were talking about, and it just comes in and plays cleanup. It removes all the bacteria, viruses, allergens, and probably most importantly, those LPS particles. Those are the ones that are linked to autoimmune and dementia. And then in the PM pack, you take those same three things, and we've added a very high quality, third-party tested ashwagandha, which has been shown to decrease anxiety, decrease cortisol, and improve sleep. So the combination of these four high-quality natural ingredients work together in specific ways to help you get over SIBO. And we're very excited because we're able to put this together in a box that we can deliver to your home in a pre-packaged way so that you have a much easier way of being compliant, AM and PM. And we're doing this at a very affordable price delivered to your home. So when I treat SIBO patients, some of them can be very tough to treat. And one of the reasons why I wanted this to be a full month is that sometimes it can take even a little bit longer to actually start seeing significant release from SIBO. So if you choose to do this, be patient, but it's all working on a cellular level, helping you become healthier.
100%. So some folks may be asking, if you look at this and you look at what we've put together here in these packages, how much would someone actually be saving doing it this way versus if they were to go out, and we won't get to the product selection yet, just if they were to go out and find this kind of stuff, what is it that someone could save doing something like this?
If you're going to try and do this on your own with the high quality products that we have, not putting in a box, not having it there, you're looking at close to $200 where it's to do these high quality supplements like this. Like all things, if you say, well, I'm going to go and order this I'm going to order something and it's much cheaper, that's fine, but you get what you pay for. You have to have third-party testing. You have to know where it comes from, and it has to be high quality. Otherwise, it's just a waste of the money.
There is absolutely no product that this guy is going to put his name behind if it doesn't have third-party testing and a certificate of analysis, and essentially is going to be exactly what they say it's going to be, and the active ingredients have to be available. So that's effectively what we did with our partners. It's how you vetted it. I mean, this wasn't something that was overnight. This is something that is many years in the making.
And so you asked how much it would cost to actually get it done if you tried it on your own. And so we know it's going to be well over $200. We're offering it for $149 because I want to make it affordable for all my patients. So $149, this box arrives. You get a full month's worth of those products to work in synergy to help with all that.
Yeah, I think the best combination that we found of using the same quality products to put this together was at minimum $227 and up.
Yeah.
And to build this exact makeup of all of these different products. However, it didn't come with the appropriate dosing. It didn't come with an easy box to keep it in one spot. I mean, you can shake this around. It doesn't sound like a bunch of bottles banging around in your duffel bag. But there's lots of convenience here, and it's actually afforded to you at a less expensive cost, and you could have one per month and be set.
So my patients have been really excited about this, and I had to laugh because we had like the first few arrive. We're going to put this on the website real shortly, and my patient was so excited. She unboxed it, and she threw the sleeve off, just started unrolling it. I'm like, no, it doesn't work that way. You leave this on. It's very nice, single packet at a time. So she was walking out with a whole roll of packs behind her. And I'm like, no, it's not why we did it that way.
Yeah. Well, it's quite convenient, and just as you highlighted, the products that are in here are high quality. Everything's been tested, and the dispensing of each dose is quite easy, can't be lost, and really easy to kind of tear and go. It's kind of hard that if you happen to be a SIBO sufferer and you still not quite found your pathway back to health, I think that this is definitely a must try, not just to consider, but a must try to see if this is maybe your angle.
Consider giving it as a gift heading into the holidays or birthday or anything where somebody might want to indulge a little bit more. Give them the old SIBO Support Health Box.
Yeah, 100%. But maybe while you've been going through all of the different functions of the ingredients, maybe someone's able to kind of piece together, I've got this gut issue, and I haven't really thought about it, but I'm not sleeping a full 7 or 8 hours a night. But I don't seem to get quite better, but I can't get better if I don't get enough sleep. There are lots of little bitty things that kind of trickle back to someone who's not in full SIBO explosion yet. Maybe this is the first cold winter spell that you've ever had a patch of eczema get a little bit larger. I mean, eczema usually is indicative of some type of GI distress. I know because I used to have it, and I don't have it anymore. And you never know. You never know what might be triggering some of your other manifestations. But more often than not, chronic inflammation is basically the little basal reason why you have these issues.
What I'm really excited about is as my patients start taking this box on a regular, and they possibly do a couple months worth, even 3 months worth, and I bring somebody back and they're saying, yes, my bloating's better. I expect that because we know Atrantil is really good at that. But when I hear my anxiety is better, my brain fog is gone, and I'm sleeping better, then home run, we've done it. We've changed the trajectory of their health.
Yeah. Well, maybe for so long, we just didn't know that we could attribute some of these other ancillary issues to just gut inflammation. I didn't know that. But now that we can draw these pathways, and every day it feels like we can validate a little bit more the gut-brain axis. And that's quite important. It doesn't mean that everything that happens between the gut and brain is good, bad. It's actually everything. If the gut is upset, then you don't always think clearly. And so that reciprocity between the two is a very, very real thing.
Absolutely. So if you're interested in this, we're launching, but we may have some limited supply. So please contact us through email and say, I'm really interested in this. So, earmark one for me so that we know how many to order, because we've ordered quite a few, but I have a feeling we're going to run out once.
Well, we've already placed 2 orders and they've already sold out. So that's kind of how that goes.
And we haven't launched yet.
Yeah, we haven't done anything yet. This is where, okay, so now that we've told you all about the box, this is where y'all get to see how well Ken and I plan.
Yeah, so it's
really good at the science, not so good at the part.
We have Steven, who is the director of operations, to make sure that doesn't happen. He's heavily involved in this one. He's already saying, you need to order more. And I'm like, no, we've got 2 left right there. He's like, I just got an order for 10.
Yeah.
So anyways, that is episode 92. I'm really excited about this one. This is strictly to make a difference in people's lives. When this box shows up, we wrote here, your health has arrived. And that's really how I feel about this. If we could make a difference in people's lives and change those different things, all these people that feel like they have irritable bowel, but told by their doctor, they just, you just have irritable bowel, there's nothing else wrong. And you're like, I'm not sleeping, I have anxiety, I have brain fog. We're going to try and help that for you.
KBMD Health SIBO Solution Box. Available at kbmdhealth.com, where now we are simply asking for you to send us a message, and then we'll earmark one for you. And then very soon it will be a full function order and just like any other product that's available on the site.
Absolutely. Once again, thank you. And Carol, happy birthday. Thank you for everybody else that sends us emails and gives us feedback. We want to hear about it. It does help us if you go to the Apple Play Store, or what is it, the iTunes Store and Spotify and the usual places. Check us out on YouTube. We want you to see the box. So go to our YouTube channel, Gut Check Project, and give us some feedback. We would love to know what else to do. We got some really exciting guests that we have planned coming up, and it's just, it's really fun to start making a difference in people's lives. Please like and share. That's going to do it for the KBMD Health SIBO Solution Box. Thank y'all very much. We'll see y'all next time. All righty.